I'd like to invite Dr. Mary Mccaskill to the stage to give us a view of what the future of safe care looks like, looking at what we've been discussing today, her views across that. Now, Dr. Mccaskill was appointed Director of Medical Services and Clinical Governance in November 2020 for the Children's Network. Her bio is very long, but since time is very short, I will hand straight over to her.
Thanks very much. So here I am just summarising in a couple of minutes everything that's happened today. So that's a bit hard. So I'd like to ask you, the panel, who has fallen asleep today? Well, I have. I fell asleep early this morning, but that was before I got here. So that's good. Who has eaten one of those Ferrero Rochers? Excellent. Now is your chance. Everybody else, there are some left over. Could we pass them all around? That would be really good, because nobody wants to leave all the Ferrero Rochers to the people handing them out, because you guys are going to eat them all. That's what I'd do. So who's learnt something today that's interesting that they didn't know? Who's seen the research stuff and said, oh, that's interesting. Actually, you could look at it like this, because I wanted to make a whole lot of comments to those research things that I saw. So that means that there's a lot of things we could talk about. Who's a parent, an aunt, an uncle, a grandparent? There's very few people in the world who are not in that involved. Or somebody they like the kid next door, that type of thing. Who's ever been a child? Well, most of us. It's an important part of the ecosystem. So it's very important that this is obviously relevant to all of us, what's happening here. Now, how interesting that all this research has been done in the most complex area in the world, in health. Health is not simple. Public health is not simple. Private-public partnerships are not simple. And then you do it in paediatrics. Now, we know that most drugs that get produced and most research that's done, you do it in the New Zealand white rabbits, which we all know, not to our New Zealand friend here, which we all know are the middle-aged adults is who you do all research in, because they're all fairly homogeneous. Actually, they're not homogeneous at all. Many of us here don't feel terribly homogeneous. And a really important comment we had from our consumer forum person who said all consumers are not the same. I know it's bleedingly obvious, but we do tend to think that all humans are 60 kilos if they're women or 70 kilos if they're men, and all of a sudden you remember our own weight and go, probably doesn't apply to me. And so for children, of course, that isn't right at all, because they're all different sizes and shapes, and they've got these parents who come along and cause all sorts of troubles. So at 1 a.m. this morning, this morning, I was writing up intranasal fentanyl for a patient who had a broken leg, and then also some oxycodone for the ongoing pain that he was going to have. And yes, Madeline, I did ask him about his medication and talked to him we were going to shove something up his nose and that would make the pain better. And he looked at me and went, will the snot come out? And I went, maybe. And then he told me it worked quite well, but not as well as it might have been had there been less snot in there. So that's a really good point. So I think it's important that I thought the value of talking as a team and making the parents part of the team and the child part of the team is really important. I think Michael Dickinson gave us the example of how you talk to the child about taking the medication the best. You go, to them, and they go, and spit it back at you. And that's talking to the child. So I had another discussion with an 18-month-old about the fluid that they needed to drink because they were throwing up. And they told me in no uncertain terms that I could get nicked, and the fluid that they were having, they were going to throw up, and if I wanted to look in their ear, I can tell you it was not going to happen. And I told them it was going to happen, so there was a bit of discussion there that went on. So I think it's really important that we do involve parents in what we do, and we've heard a lot of that today. So what have we learnt about? Well, we all know that, in fact, digital systems improve medication safety. That's great. And also double checking is not as cool as we thought it once was. Isn't that interesting? And in fact, it's not good to crush medications and not have a mask on or gloves on. In fact, in the current environment, you probably should always have a mask on and gloves on, because you might catch some horrible germ. And also it's important safety for clinicians. There was quite a lot we heard about that, both psychological safety, enabling people to do a good job, and that's really what we're trying to achieve here. So it's interesting what's happened here is we have had a major change in the health system of introducing both an electronic medical record but electronic medications management in multiple systems. We've heard about it at Northern Beaches as well as in New South Wales Health. You do a massive change and you actually research it and find out what worked and what doesn't work, and that can help us for the future. And I think what we've heard today is not only what went well and isn't that great, but actually there's a lot more work to do. There is so much more we could find out about this. And, you know, the opportunities are just endless, and we need to not forget that. It's very easy to say, oh, it's just a bit hard. Could we just look at what we've already done? And good on the guys who have already published, but there's so much more work we need to do with this. And analysing the benefits we heard here, the benefits we can see, but also the benefits we didn't measure and other things that are there. So we're in the time of tremendous change. We're always in the time of tremendous change. People in every generation have always said that. However, we've had this interesting thing called a pandemic, which has changed all our behaviour. I have never worn a mask. I work in the emergency department. I have never worn a mask in the emergency department. Even in the flu pandemics in the past, I went, masks are not for me. I can tell you, I wear a mask all the time now, and I'm so much less sick. It's great. So I am going to wear a mask from ever on, and that's only just me looking at it. Washing my hands, I'm a doctor, we never wash our hands. I can tell you, I wash my hands so much that once I look at someone, I go, ooh, I better wash my hands. So it's really good. So you can see these things have had a tremendous impact on my own behaviour, and then when you do that to all the staff in the hospital, and indeed all the families. So we have little 5-year-olds that come in with these cute little masks on, and they are very good at washing their hands. Has anyone got a child at daycare? I can tell you, they know all about washing their hands much better than adults. They walk in and they wash their hands, and they come into the hospital and they can't reach the hand basin, so their parents lift them up, so they wash their hands or put hand sanitizer on. It's really, really interesting how we're changing how the population acts. And that's what we're trying to do with medications management. We're trying to change the way staff act, and actually parents and families as well. So a lot of change going on. Virtual care used to be a sort of virtual thing that was talked about. So care closer to home, care at home. We have people who, we have a problem when we're trying to do consultations, and we ring the mum up and she says, oh, I'm at the shops. I haven't got the child with me. Do you need to see the child? I'm busy, I'm doing the shopping. Because that's how much of life now happens by the phone, online. So that's a tremendous change of population, which we can change then the way we deliver care. We're also building new buildings. The 2 children's hospitals have got 2 massive buildings that are going up, as are many other health facilities. So this is changing. We have 6 people in a ward, an area in the ward. In the new buildings, max will be 2. So and most of them will be single rooms. So that's a tremendous change, cross-infection, all sorts of things. How do you check medications? How do people see what's happening in different areas? For the staff, their staff stations are very different. So the whole physical build is quite different. And then I mentioned about the pandemic, and the other thing that's going to come and hit us is sustainability. We know across the world that sustainability, we're going to be net zero by 2050. Easy to say now. Actually, we're going to aim for net zero by 2035, and you start going, oh my God, there's so much that's going to change. The concept of parking will completely change. In fact, it'll be about how do we transport, how does things happen, how do we avoid bringing the person into hospital to have some medication delivered to them, when actually that's not sustainable. So a lot of things we're going to be changing over the next little while, and the pace of change is probably increasing. I suspect every generation sees that, but I think that's the areas of big change, and that's what we need to look at, those things to then focus on how do we deliver medication safely and put it in that type of environment. So a couple of challenges that I heard to us from particularly the last session, but also the number of the presentations during the day, areas where we could do better and use this research to improve. And these are just my suggestions, but there might be other ones, but I've heard quite a lot of things today. So it's interesting that, because I work a lot in quality and safety, we often say this is a recommendation of how we change something. And we say that sounds like a good idea. Double checking sounds like a good idea. So now we do the research and say, was not that good an idea? Perhaps there's a different way. And as Alan Gardo said, perhaps we need to look at it in a different way. So that's important. The things we think will change things and make it safer, we need to test. And that's what the research is doing, which is great to hear. The second thing we need to know is how do digital systems change safety and, most importantly, human actions? Now, as a doctor, I heard someone tell me they were going to fire things off to the doctor, and it certainly feels like it. The machine shouts at me and it says, do this, do this, do this. And then I find, where is the exit button to just get things happening because I have a patient in pain? Oh, there it is, boom. Or I've got to, press all the buttons and I never really read what's on there. And we all know, I know none of the pharmacists here have done that, but all of the doctors have done that. And that means the system is shouting at me, not working with me. So how do digital systems and how did these changes happening? And much of the research that we've heard today has shown us some of how did it work. Because if we know how we can change actions, then we know how to make things better and how to make it easier for clinicians to do that. So then there's human factors. Now we know all about, or I don't know, but people who look at the research the digital system can look at and see, how do I look at a screen and what buttons do I press? And you know, I know my system, it's an up there or a down there, but then there's the other thing up the top called ad hoc, which you just look at other different things and find where you're going. So we can analyse that and make it work much better. Now the people who are experts at this is obviously our digital colleagues and our friends in the really big corporations. Google knows everything about me. If you're going out to dinner on the day of mourning tomorrow, I'm sure that you're not going out for dinner because you'll all be mourning, Google knows where you're going. Google can tell you where the nearest parking station is. Probably WhatsApp knows all about it too. And your friend Apple. In fact, if somebody rang me the other day and said, why are we FaceTiming? I said, I don't know. I think Apple knows that you and I both have iPhones, so somehow we're FaceTiming. You know, this world knows much more about, the digital world knows more about me than I know about myself. So we can use that because we actually have that information. So how can we make it so that the person who's delivering the medication can do it more safely, the person who's ordering the medication can do it more safely, and also the patient and family who are receiving the medication can know that it's coming, know there's something different happening, know that it's different to the last time they had it for XYZ reason. Many people are now connected digitally, and we can use that with the research we've got. So this is a challenge, I think, to all of us. How can we use the data we've already got more effectively? And yet think about the people who don't have that access to digital stuff. We've got those vulnerable people and we say they don't have a phone or they don't have any data. So with some of our virtual work of people at home, we had some populations who had a phone but had no data because data's too expensive. You know what you do, you pop into the local Macca's and you use their Wi-Fi. And so how do we make it work for those people too, so that we don't create a system that only works for the people who've got a phone and got data? So that's important, particularly for young people, because those of you who can remember back to when you were students, you're usually nicking other people's Wi-Fi. You usually didn't have it yourself. Okay, so that's a thought to put in there. And then the other thing I'd like to look at, I've done quite a lot of work with clinicians looking at improving what I call the work life. So it means when you turn up to work, how can I do my job more effectively? And I would suggest we need to move away from how do you make it, I've got to make sure I get this the right way around. Currently we talk about we make it harder to make a mistake and that makes it safer, but you're also making it harder for me. More things come up. What I'd like to see is how do you make it easier for me to do it better? And a comment came up just before talking about clinical reasoning or time for thinking or making an intelligent decision on how you treat a patient, or heaven forbid even talking to the patient. So we need to have more of that. And I think it was mentioned, Mark mentioned about the life around the patient, the world around the patient being a little quieter, so we can actually really focus on what's important, which is the clinical care, which is talking to people. So what we need to do is use our digital systems to improve that, so it's easier to do a better job. And in fact, it pushes me in that direction, so I do a better job. But importantly for the patient and family, they have more time talking to me when I'm not focusing on, doing 50 things at once, actually talking to them to say, how is your pain? Did that work? That thing I shoved up your nose, did that actually improve it a little bit? You should have seen this little boy's face. The thing that really helped was putting the plaster on. He went, oh, that's so much better. Because he'd had a broken leg, he didn't actually realise he had a broken leg, and he was he'd actually been hobbling along on his tibia was broken, not his fibula, so he could hobble along. And so it was miraculous, the change in this fairly ratty child who arrived, who wouldn't let anybody do anything. He was just, oh my goodness, I'm 7 and the world is now working for me. And his mum was terribly pleased because she thought he was just being a bit naughty and that's why she'd come in. So they're the things I think that it's worth being challenged about. We have so much more to do here, and what an amazing day and what a wonderful things you've had, and how many people have had the Ferrero Rocher now? Still not many. Who is the person with the... They're all gone. Oh, too slow. Somebody else has eaten them out the back. But that's probably good for all of us because none of us are the right 60 or 70 kilo man or woman, which we all know all of health assumes we are. Thanks very much, everybody, and well done today.